Hi everyone, Dr. Nemechek here. I want to discuss with you about how COVID or SARS-CoV-2 infection can lead to this other form of leaky gut and how it's related to inflammation and how we use glutamine to help our patients recover. This graphic shows a lot of components about when you're infected. So here you get infected with COVID. The thing I'm looking at in particular is this blue line, which is the inflammation that's associated with the infection. Now this is short-term COVID, and the inflammation ultimately comes back to baseline and the patients recover. But what we're most concerned about here is long COVID or long haulers. And in this case, we get the infection. Here's the blue line, that we get this chronic inflammatory phase that does not resolve and continues. And this is causing lots of problems in patients. And one of the things in particular is they've discovered that it's causing a different form of leaky gut. Now, this whole line here is the barrier of the intestinal tract. So over here on the far left, it says normal. That's supposed to be a bacteria. So there's very few bacteria, and nothing's breaching this intestinal barrier, what we call the intestinal epithelium. Now, what we've talked about before in my work is you have excessive bacteria in the small intestine. I use the term SIBO. You can bacterial overgrowth, dysbiosis. These are all basically equivalent terms, and you get leaky gut. And here, so these are excessive bacteria. Things leak between the seam. See that? All right. And down here's the immune system. You don't have to look at all these details, but this is the immune system, and that leakage triggers inflammation in patients. Now, what's being shown uniquely in COVID is that it's not leakage through the seams, but it looks like entire cells will actually undergo death, or what we call apoptosis. And now you can have large amounts of material flowing through here. And now this type of leaky gut is associated with high levels of inflammation. And that's what I'm talking about here. These high levels of inflammation, it's looking like, are capable of triggering this form of leaky gut. This form of leaky gut also occurs in other medical cases where you have high inflammation, such as people with severe burns, celiac disease, some chemotherapy regimens, multiple trauma, like you've been in a bad car wreck, HIV infection before we were able to control the viral infection would all develop this. And we know that you can repair this by supplementing with glutamine. So this problem, if you're on inulin or rifaximin or the PHGG, these things will only get rid of the excess bacteria and help reduce leaky gut like this. They will not help with this, with these clusters of cells that die. What we know is glutamine is the primary thing that will fix this. Now, just as a reminder, here's a cross-section of the small intestine. You have this little barrier. When you are leaking through into this tissue here, it is a massive amount of inflammation. You have about 70% of the body's entire white blood cell mass is right here. They are not circulating in the bloodstream. That's only about 3% of your white blood cells. 97% of the white blood cells are parked in the tissue, and 70% are wrapped around your small intestine. So that leaky gut, you get products of bacterial or viral, cell wall products here, products from food. You're going to have a massive inflammatory response. Now, and that massive response leads to a decline in glutamine. Here's a little graphic. So here, see down here, health. When somebody's healthy, we can make our own amounts of glutamine that we need. So liver, skeletal muscle, fat tissue, lungs, make glutamine. Yeah, GLN stands for glutamine. Kidney, brain, gut, and the immune cells need glutamine. Okay? So there's a nice balance here from synthesis to consumption. Now, when you're sick, here, your glutamine levels, that's what's measured here on this left side, the glutamine levels decline because of the increased consumption. Okay? You can only make a small amount. You have increased consumption of glutamine, and in particular, a massive increase of consumption by your white blood cells, your immune cells, when you have high levels of inflammation. And again, that leads to a glutamine deficient state, the intestinal tract deteriorates, and these holes start to develop. So we've been, in my past experience with this, we've been using this in some of our kids with autism and developmental delay, and what we see is a rather impressive response. Now, pre-COVID, our responses to the protocol in children and adults was fairly predictable. With COVID, I sensed something was going on, and I think in the majority of the cases, it's having to do with this glutamine deficient state. So here are 103 kids with autism. Some have a well-described and test positive COVID. Many others might be, several people in the household had COVID and we didn't test our child, but he was just mildly sick, so we assumed he had COVID too. And so out of 103, now we have about another 100 that are taking this. We just don't have follow-up yet. On 103 children, the parents are noting about a 65% of the time, these kids are starting to do much, much better neurologically. Autonomic dysfunction is improving, and what's happening is it's a reduction of inflammation. Many of the children were having diarrhea, or not even so much diarrhea as what we call postprandial diarrhea, where they would eat and have to go to the bathroom afterwards. It's very abnormal, and that would all improve. Typically, the improvements are noted within 1 to 2 months. Here we have a good third, no improvement. All right? And I'm not surprised by that, since we aren't certain if these children had this long-term COVID issue, and if after 1 or 2 months there's no benefit, we just stop the glutamine. All right? It's very safe to use. It's been used for a long time in children. We have a lot of data about that. 7%, so it's only 7 out of the 103, had an adverse event. And so this, in multiple descriptions, just kind of irritable, maybe a little more aggressive, maybe just unhappy. We can't tell if they had maybe some tummy pain from it or what. But we would stop the glutamine within, a few days once we saw that, and their symptoms would all go away. So it was very mild, but notable and short-lived when you stopped the glutamine. The glutamine I prefer to use is by Now Sports. It's very reliable. Now Sports, Now Food. This is some of the inulin and fish oil I've recommended in the past are made by these people. You typically need the powder. They sell capsules, but you won't get the dose high enough. So like 1 teaspoon is 5 grams, 1 tablespoon is 15 grams. So down here are the dosing regimens we use, and it's somewhere between a half a teaspoon twice a day to 2 teaspoons twice a day. But I encourage you to do the dosing calculations here on the screen. And then what that will do is fairly quickly heal up this gut, and then the associated leaky gut stops, the inflammation from that stops, and the children are functioning better. So I'll be providing you more updates maybe in a few more months when we have more feedback from these other parents that are using this. And we're collecting data on adults. It's been quite effective for adults as well. That's all for today, everybody. Have a good one.